Hi, I'm Rimple. I work in corporate relations for Kingsbridge, and today I'm talking to Laura, one of our GPs here at the hospital, just about mental health awareness, and what we can do to look after ourselves. Hi Laura, thanks for meeting me here today.
No problem.
We sort of thought that given everything that's been going on in the last year, we should just keep this conversation about mental health going, and especially amongst the Kingsbridge staff, just to talk more about it and find out, what we mean when we're talking about mental health.
Yeah, so when we're discussing mental health, we're discussing mental well-being really. And I think we ought to think of it more like our physical health in terms of taking care of it. Our mental health is at present perhaps more fragile in terms of the turbulent year that we have all been through with COVID. I think it's important that we recognise that in ourselves and others. It's important that we think of mental health on a spectrum as well, and anybody is unlikely to have a fixed position on that spectrum. Various stressors and challenges in life will negatively affect it potentially, and particularly, as I've said, off the back of COVID, a lot of patients are describing themselves as feeling burnt out or overwhelmed, and although they may not recognise that as any form of negative effect on their mental health, really it's a description of a slip in the position on that spectrum, and it's our role as GPs and health professionals to detect that and intervene and offer help for that could slip towards a mental illness such as anxiety or depression.
Okay. And can anyone suffer from mental health issues?
Yes, incredibly common. 1 in 4 adults in the UK in any 1 year will experience mental health problems. And there are certain groups in society for whom it is more prevalent. And for example, young women aged 16 to 24, members of the Black or Black British community, those who identify with being in the LGBTIQ plus community, and those with significant social stressors such as homelessness, substance abuse, or contact with the criminal justice system.
Yeah, and that sort of touches upon what can cause mental health issues. Is there anything else that can really exacerbate it?
Well, I think like physical health, to draw that comparison, it's a combination of biological and lifestyle factors, and it's multifactorial like all illnesses or health conditions. So biologically, what I mean by that is genetic factors or family history, and also then chemical imbalances within the brain. The role of chemicals such as serotonin and dopamine within the brain are poorly understood, but what we do recognise is that medications used to treat common mental health conditions such as anxiety and depression, which work on these chemical levels, do seem to work very well. And for some to identify with a physical cause for their mood changes, that makes it easier for them to understand, but also to discuss. And in terms of lifestyle factors, then it's really life experiences, so abuse, trauma, grief, financial difficulties, discrimination, stigma, stress. All of these factors can have a negative impact on our mental health.
Okay. Is there any way you can prevent mental health issues or even improve your own mental health?
Yeah, the first thing I think is awareness, and we all need to be aware of our own mental health. As I say, we are our physical health, and I think it's just important to think of the two together. So to recognise warning signs, a lot of people will say they recognise that they may be turning down social invitation and starting to isolate themselves, for example. It's good to keep a mood diary, because some people will notice that they feel worse at certain times of the month, for example, or following certain occasions that have arisen, or work scenarios. It's important, I think, to identify those stressors so they can then prepare the next time they arise. And talking, I mean, like we are now, just talking out in the open, talking about mental health is so vitally important. Talking to friends, talking to family, and talking to health professionals if indeed there are any concerns. And then making time for relaxation is so important. That would include mindfulness, which is a popular therapeutic technique which focuses on awareness of the present moment.
Okay.
And in practicing mindfulness, it allows you to be aware of your thoughts and also your reactions, and create some space between your thoughts and you. It's got roots in Buddhism and meditation, but no spiritual beliefs are needed to practice mindfulness. Other popular relaxation techniques include ecotherapy, which is really just an appreciation of nature and recognising that a sense of calm comes with that connection with nature and a sense of escapism. And I found it interesting recently during Mental Health Awareness Week, as members of staff shared their own experiences, the number of photographs which were of beautiful landscapes and nature. Yeah, and I think again with COVID, when we were so limited in what we could do, and a walk a day was the one thing we all looked forward to. I think that's maybe one positive that has come out of the whole thing, that we are continuing that. We recognise nature all of a sudden. We were maybe taking our surroundings in and recognising the calm and stress relief that brought. And then also physical health, it's vitally important as well. The two really go hand in hand. So looking after ourselves in terms of diet and other lifestyle factors such as exercise. Exercise will give immediate benefits with serotonin releases, so it'll just provide that lift and sense of stress relief, but also then longer term help self-esteem, and also then alcohol and drug misuse, avoiding that and just keeping a sort of healthy, consistent physical state really will have a positive impact on mental well-being too.
Okay. What can I do if I'm worried about mine or a loved one's mental health? Where do I go? Just to wrap up, I suppose.
Yeah, well, talking again is the most important thing. Although there is a temptation, perhaps because of stigma associated with mental health, people are reluctant to talk, but we're really trying, and I've seen it within our workplace, to break down that wall of stigma and the taboo. And I think it was really amazing to see how that was achieved in a short period of time during Mental Health Awareness Week. All of a sudden people were sharing their experiences and day by day encouraging others to do so, which was fantastic. Also talking to health professionals, should you recognise that mental health has dipped to the point that perhaps there are symptoms of depression or anxiety, it's important to seek help early, as you would with your physical health. So speaking to a GP, or if you're already known to mental health services, community mental health team or crisis support worker. And in terms of loved ones, that can be really, really difficult. It's important to find time when you're both relaxed and have time to talk and to broach it gently, because bearing in mind that your relation or loved one may not recognise that they have any issue, or indeed they may be embarrassed. So it's just broaching that really sensitively. And if they're having symptoms such as hallucinations or delusions, they may see those as real. So it can be a really, really difficult conversation to have. And if you've grave concerns about a loved one, well then obviously we need to speak to a health professional such as a GP or an A&E unit. There's help available 24/7, and I always do stress that to patients, although A&E may not be somewhere we want to be at this time. Help is available around the clock, and if there are significant concerns, that is the safest place to be.
Brilliant, thanks so much.
No problem.
Thank you.
No problem at all.